The United South and Eastern Tribes is proud to introduce Social Impacts of Health. Do you know about the social impacts of health? We'll break it down for you. Social impacts of health are conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. There are 5 key factors that can impact your health: economic stability, education, social and community context, health and healthcare, neighborhood and built environment. Examples of these key factors are employment, high school graduation, discrimination, access to healthcare, access to foods that support healthy eating patterns, crime and violence, and quality of housing. So why are all of these social factors important? Well, here's an example. So let's say you don't have access to a supermarket that support healthy foods, and the only access you have is to fast food or cheap eats. Well, that could lead to obesity and high blood pressure, which is bad health. Addressing these social impacts is important to achieve health equity for your tribal nation. Health equity is when everyone has a fair opportunity to live a long and healthy life. Social impacts of health are life-impacting resources such as food supply, housing, economic and social relationships, transportation, education, and healthcare. The distribution of these resources effectively determines length and quality of life. Conditions such as polluted environments, inadequate housing, and lack of educational and employment opportunities are implicated in producing inequitable health outcomes. These disadvantages are interconnected and intergenerational, and associated with a lower capacity for a full participation in society. There are great social costs that arise from these inequities, including threats to economic development, democracy, and the social health of a nation. When inequities are high and community assets are low, health outcomes are at their worst. When inequities are low and community assets are high, health outcomes are at their best. Your departments are collecting social impacts of health data and may not even realize it. When the data from all the different departments can be combined into one database, powerful information can be discovered to reveal community strengths and weaknesses. For example, those who overdosed on opioids were more likely to have passed arrest, depression, homelessness, and have even been assigned a caseworker. Do the various departments, health, criminal justice, housing, and social services, all work together to address opioid concerns early? The USET Tribal Epidemiology Center can examine this database to determine what specific social determinants of health are positively and negatively impacting your community. With stronger data and more effective reporting, grants will be strengthened and programs can be more targeted to effect change. A healthy community is determined by more than your health department. Through multiple departments connecting and sharing data, solutions to problems such as the opioid crisis, homelessness, and many others can become more visible. For more information on how your departments can connect to benefit your tribal nation, email the USET Tribal Epidemiology Center.